As you know, one thing I've been focused on the last few months is how do we make sure we control our healthcare cost? One of the things that we need to do is we need to have transparency in healthcare. Our healthcare providers, our hospitals need to tell people what things cost. People need to feel comfortable that they're not being price gouged. So let me just give you a few stories, and I've had stories from around the state. Let me just tell you some local stories. We have another individual whose son broke his ankle in a car accident. He goes in the hospital to get an x-ray, and he was also frustrated because after the x-ray he waited 3 hours to see a physician, but saw a physician for a short period of time, and the bill was over $3,000. And it wasn't even casted there. It was sent to pediatric orthopedics to have the cast done. $3,000, over $3,000, basically to get an x-ray done. We have another lady that went in with high blood pressure and ended up staying in the hospital for 4 days. The bill was $78,000. And then another individual I spoke to went in with some chest pains. The bill was $2,300. Then they didn't even bill the right insurance company, and so ended up in the last two cases have both turned over to collections. In the case of the $2,300 bill, the individual gave the credit card company his credit card number, so a bill that he shouldn't have been charged should have gone to the first insurance company. He now has a $2,300 credit card bill. Interest is growing at 18% a year. He can't pay off the credit card bill, and they still have not been able to resolve this. And it's somebody that's making about $10,000 a year, so they're really struggling.